I'm not a doctor. We know this, right? I'm not a doctor. I'm not doing this today because I'm gonna diagnose anyone or be handing out any type of advice that should go to a doctor anyway. This is just things I have learned over the years from being in chronic pain myself, and what has worked for me, and how long I've been doing this. And I was diagnosed with MS in 2012, but I can date my chronic pain and back pain back to very early on in my 20s. And so while I was diagnosed with MS, I can back up the MS quite a few years. And I do what a lot of people did. I treated it with over-the-counter, sometimes prescription. I was at a pain management clinic getting injections in my back and RF injections and really heavy like steroid injections and all of it for my back. But then I started exercising. And without even knowing it, what I was doing was relieving some of those symptoms in my back. And the longer I've done this, I can go back now and go, oh, that's why it worked, right? Okay. And I want you to know I have a lot of empathy for people who deal with pain. It's exhausting. And I think there's a lot of times we just tell everybody we're fine, we're fine, we're fine. And that in itself is so exhausting because you're not sure anybody wants to hear it anymore. You're not sure anybody's gonna get it or know what to do for you. And so I also want you to build communication skills on what you need, which means you're gonna find a family member or a friend today and say, this is what I need and this is what I need help with. When I'm in this amount of pain, sometimes you can be in so much pain you can't communicate very well, right? It's too much. And so you need to already have told somebody, hey, I'm at a level 12 on a scale of 1 to 10, and they'll know what to do. My family has gotten so good. From my dogs to my husband to my kids, my puppy will crawl up, warm me up because I tend to get the chills with it, come and warm me up. Lights are going out, medicine's being given, whatever, they all rally. And it's a pretty awesome thing. But that didn't start happening until I told them what I wanted. So I want you guys to comment on here. Jonah's on. What? Hey there. I want you to comment because this is going to be a conversation for a few minutes before we even get into the exercises, right? So make sure you've cleared any exercise program with your doctor. I just have to say that. That's my disclaimer. Plus Eric's an attorney, so if you do sue me, I guess I've got backup, right? When you start strength training, it's 2 to 3 days a week. Especially if you are brand new to working out, 2 days a week. And it may be very little. I'm not gonna give you how much time to spend doing it or anything like that. When you feel comfortable with the 2 days, add the third day and not in a row. Make sure, that's why they're 2 to 3 days, because we want your cardio in there too. Make sure that you've got, from the get-go, we're gonna talk about proper breathing and posture a little bit. We're gonna go over that a little bit. But you've gotta know that while you're working out, that breathing is, you've gotta get oxygen to your muscles and to your joints, right? Okay. And also I've got Bree on here who is a personal trainer. So Bree, if you've got anything to add to this, add your expertise, girlfriend. I am never gonna claim that I know it all. The older I get, sometimes the less I know. When you start with exercises, especially with strength training, you're gonna start with 8 repetitions. That's our goal today, 8 repetitions. When you've got 8 down, you're gonna build it up to 10. And from there, when 12 feels like it's getting easier, we're gonna add weight to it. All right. If you're in a flare-up today, or if you're experiencing pain that isn't from regular muscle soreness or from working out, you're gonna take this very light today. You may just be watching this video today, which I'm totally fine with, because like I said, a lot of us are fasting today. If you wanna just watch this video, do the exercises later, great. All right, some questions that I've got asked. What is chronic pain? Chronic pain is anything lasting more than 3 months. Back pain, knee pain, whatever. You could have, it could be from an illness like my MS or fibromyalgia, things like that, the nerve and the brain misfiring and you're getting pain signals. So different types of chronic pain: headache, cancer, trauma, back pain, there's arthritis, neurological, by disease, right? So if you think about that, there's over, I think 2018 was over 50 million Americans suffer from some sort of chronic pain. And 19 million of them are debilitating to the point where they're no longer able to do the normal things that they used to do. That's a really high number, right? So my goal with this is really reaching out and showing you how to feel better. I'm not changing your chronic pain. I'm not your chiropractor or your PT or anything like that, but I know that moving makes a tremendous amount of difference, right? For those of you who go to the gym already and go and work out, how do you feel when you're done? You're like, oh my gosh, so glad I did that. But it is that initial rolling out of bed and getting there. I told my husband what I really need is a video of what I look like getting out of bed and at night when I'm going to bed, because it is a night and day difference. I look like an 80-year-old going to bed. My joints are locking up. That's when the pain settles in, is usually evening time for most people, right? Okay, so chronic pain in and of itself is your nervous system, right? You get injured, it sends a signal to your brain that you're injured, right? And you've got that communication happening. And so around that injury, right, it's active and it's firing signals that something's got to happen. And as the injury recovers, that firing up signal starts to calm down. But for chronic pain, it doesn't calm down. And so there's still these signals that are saying you're in pain, you're in pain, pain. There may not even be anything wrong. There may not be no injury anymore or whatever, but it's still sending signals. There's also the fear that settles in with chronic pain, that if you're going to do something, it's going to hurt. And so retraining the brain that you can do something, right, is a big deal. Just like if you've ever dealt with low back pain, what's the first thing you do when you go to sit down? You grip your back muscles. You know you do it. I do it still. Because you assume it's going to hurt. And so you grip. So you're firing up. Now instead of firing up the core muscles that need to fire up, you're firing up your back muscles instead, which is leaving this to just do its own thing. So when we get into those exercises, we're going to talk about what exercises to do. So hang tight with me. Hey, Therese, Sherry, look at everybody hopping on. I love it. Okay. I want you guys to have info. I also got an email and a question yesterday about food. We're going to very quickly touch on that. Not my expertise, except for what I know about me and the basics. But if you need somebody with nutrition, please go see a nutritionist. You've got foods that cause inflammation and foods that don't. And if you're going to continue to eat processed food, your inflammation's going up. So if you're somebody that already deals with chronic pain and you're still eating that pizza that isn't really food, it's processed whatever, your inflammation's going to go up. Sugar, sorry, it's a big one. So look up the list. We've got Google. So Google those inflammation foods, but you know what they are. You kind of already know, right? And I don't even think it's a matter of knowing what they are anymore. It's that you have to do it. And so when I went gluten-free a year ago, I'm kind of lucky that my brain, because it's already a little haywire, doesn't actually send signals that I crave anything really. And so it wasn't too big of a deal for me to just take out gluten and go from there. I took out gluten because I was having issues with my stomach. Gassy, bloated. I looked like I was 6 months pregnant half the time. And then stomach pain kicked in. So I took out gluten, and it was 3 months later that I realized my pain had gone way down. The inflammation from taking out, and I didn't eat crappy, right? Already, I was eating whole wheat, and I must have been adding something in, but I probably was eating some processed food. I like hamburgers. I like hamburger buns a lot. I am sad to give up hamburger buns, you guys. Gluten-free hamburger buns are not the same. But you know what I'm talking about. Sometimes you just miss with gluten-free food. So taking out that, find what works for you, but guys, you've got to lessen the sugar. I know I'm a swig every day. I know that. But it's not an 80-ounce thing of pop, right? So just watch your sugar intake. There's moderation in all things, right? All right. Some people have asked about plant-based protein shakes. I know Ideal Fit was a big one. And some, I'll post a couple later if anybody else has any. I don't do completely vegan, so if you've got any suggestions on that, for sure. Okay, anyone have any questions before we move on? Listen to your body today, you guys. That's gonna be a big, big deal. Listen to how your body is feeling, right? You guys are so cute. Okay. Hi, everybody. I'm going to show you what I use when my muscles are freaking out. And this is not me promoting for any one company, but I'm going to show you the whole list of things. I know, it's a lot. Why? Okay. So these are little, I think they're called rubs. They're called rubs. You can get them on Amazon. And I just use them. You can get them in a little bit bigger size, but this is what I use for my hands. It's hard, and I use them for the nerves in my feet. So your hands and your feet have a ton of nerve endings. Also down around your tailbone, right? Where your spine. So I use it, you guys can't see me roll my foot right now, but I use it to roll around on my foot. This is a hypersphere. It's the same people that make the hyper gun, the big gun for your muscles. This vibrates. So I don't know if you've ever had a muscle spasm. They can hurt quite badly. They're very similar to like pregnancy and like your muscle freaking out. But when you turn this on, this is the more expensive of the items that I've got. But you can lay on it. So if you have questions about what this is, message me. But this one has like several different settings, and it's pretty, if I turn it on. Yeah. So it's actually one of my favorite new things to get a spasm to work itself out. Foam rolling. This one is softer. This one is the fascinator, and this one is hard. This one will get into some of your fascia and this one gets really deep into the fascia. What's your fascia? Your fascia is the coolest thing ever. The fascia is the net around your body. And we almost need to have an entire workshop, not by me, on your fascia. Your fascia, it looks like a spider web, really, over your entire body. It's what connects your organs. It's right underneath your skin, head to toe, right? And if you don't drink enough water, it's like trying to wring out a sponge with no water in it, right? Your body is that sponge, and you've got to have water to be able to stretch, to be able to move, right? Your muscles and your fascia, all that needs water. So make sure that you're drinking plenty of water. Okay, guys, guess what? We're moving on to the workout. Unless you've got questions. Anyone? Okay. Did I hit on kind of everything? I hope so. This video will stay up, and I can answer questions later too. So, things to remember with adding exercises for chronic pain. Movement is so important with chronic pain because, especially with like strength training, because you're building around the joints that are giving you problems, right? And the more you stretch those muscles out that are aggravated, whether you're in a wheelchair, a walker, there is movement that we can do. And everybody should be able to move in some way. And I realize there's some medical conditions I'm not touching on. I don't want you to be frustrated with that side of it. But from the experience that I have in moving, if I stay in bed like my brain wants to some days, my joints stiffen more, my muscles ache more. And it's not until I get up and get moving and get everything going that I'm like, oh, I feel better. So I don't care if it's from a walk to your room, to the backyard and back, get moving, right? Get that oxygen flowing, the blood flowing, right? Also, if I've been asked about weight loss with chronic pain. Chronic pain tends, if you're moving less and you're like, but I'm gaining weight because I'm moving less because I'm in pain, and it's this horrible cycle, that's when food really is coming into a big play with that as well. And then of course with the weight loss that starts to happen, there's less force and on your joints, and so your joints do start to feel a little bit better. Mine felt a ton better when I lost weight in the beginning. 40 pounds, I can't imagine carrying around 40 pounds every day right now. That's a lot. I don't even lift 40 pounds half the time, right? So carrying that around, of course my back was in pain all the time. All right, so if you've got light weights and a band, we're gonna do this from the chair. Most people in pain are not going to be getting to the floor. So if you've got clients that are in pain, if they can get to a floor, great, but let's talk about how to do these from a seated position. Now, of course, you can stand. If you don't want to be in a chair, don't be in a chair, right? No big deal. So to start, okay, we're gonna warm up, and I want you just to sit up tall. So we talked about posture in the beginning. Roll your shoulders back and down. I've got everyone's comments back on. Okay, shoulders back and down, and we're just gonna start lifting. And even this right here, right, this is using your core. You're sitting up tall, so I'm actually in the top front third of my chair, lifting those knees. And this is core. We want to start warming up the heart rate. Smile because you're happy you're moving. And even this right here, if you sat in a chair and just sat, or on an exercise ball, just doing this and practicing sitting up tall and engaging the core, that might be all the workout you need right now. Do this for a few minutes. You're gonna feel it, right? All right. Hands up, I want you to rotate and over. Your spine moves in 4 different directions. So even a chair workout should include all 4. Inhale, exhale. Proper breathing while you're doing these, as long as you're breathing deeply, right? And I'll tell everybody when I post this video, if they want to go straight to the workout, what time we're doing it at. All right, reaching up and over. And exhale. So we're stretching through the side muscle. If we rotate this a little bit, we'll get further through the back muscle and up. If you can't reach overhead, right? If you have any limitations with shoulders, you're going to be reaching to the side. Up. And then adding that rotation, right? All right, sit up tall, you guys. Roll those shoulders out. Inhale and exhale. It's kind of weird without music. Add your own music if you want right now. 2 and 1, and then forward, 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 and go. Roll that head around, and up, and back and around, and up, and roll it around, and back. Nodding the chin down, and up. So if you just popped on, we just started with the exercises. We've been talking about chronic pain for a while. And now we're starting to rotate that head to one side. So you're just tilting that chin over and then over. Big inhale up. Reach up overhead or forward if you have any limitations with those shoulders. All right, and then we're gonna do toe to heel. So if you're standing, now lifting through the calves, right? Not so hard, but if this is actually really hard for me to lift my toes up. So for someone that's got weakness in their legs, you're gonna find different areas. You may find that you're weaker on one side, and that's generally a neurological test your doctor can do. And find out how much weaker you are on one side than the other. Usually I go in and I try to figure out what my numbers are, but I'm generally weaker on my left side. So if you placed your hand here and pushed against it and lifted your knee up, it's even better if you have somebody else do it and do the other side. And find that point of resistance. A, your hip flexors are working. B, your core should be engaged, and down and up. So if you're doing this standing, I want you just marching in place, right? And then toe taps one at a time. I don't know why my screen had to go crazy like that. There we go. Don't need it colored like that. And then the other side, lift and lower from standing. All right, so just make sure that you're warmed up a little bit. There's a whole bunch of different things we can do. We're just gonna go over a few, but I did want that side to side, that extension on the back. We're gonna round out now into a modified cat stretch. Inhale up, exhale. Because when you exhale, this helps you engage the core muscles, right? Inhaling, your spine always wants to get taller, so we usually inhale. If you mix it up, it's fine. You just make it a little bit harder. And lift. Inhale. And exhale. So from the side, you can see. So when we're talking about, we'll go over knee pain and back pain because those are always some of the biggest ones. Anything dealing with joints, right? You're going to get clients, or you're experiencing it yourself. Ankle, knees, back, shoulders are always big ones when we're dealing with chronic pain. If it's an illness, then you're adding muscle in there as well. Okay, grab your light weights. Okay, so we want, like I said, we want to build strength around the joints. It does not. And you may not be using weights at all. You can do this, I'm trying to get center here, without weights, right? We're gonna take it up overhead, and remember we wanted to work on just 8 repetitions. So we're gonna move through this. We've got 4 more, 4, 3, 2, and 1, bringing it all the way down into your bicep curls. You can turn them out or keep them forward. We're gonna turn them out today. Lift and lower for 8, 2, and 4, 5, 6, 7, 8. We're gonna take them front now. Two more. And then just roll them out. So I want you to check in with yourself, right? If you're experiencing any pain, you need to stop, right? And there's a difference between muscle pain and if this is aggravating your chronic pain already. Then we know we need to take something out. If you're good to keep going, we're gonna do a tricep press. So I want you to lean forward and press back. And I generally do them this direction for chronic pain, because if I'm dealing with any shoulder up overhead, the range of motion may not be there. So you just want to leave elbows back, right? Keep them. 2 and 1. Turn the hands, we're going to press up. Keep leaning forward just a little bit. 4 more. 4, 3, 2, and 1. Hold it for 8, 7, 6, 5, 4, 3, 2, and 1. Now, we're just gonna sink through it and forward and lift. Oh, all right, got a stretch. And again, stretch it out. Good. All right. Rotator cuff. That's another big one. So taking your weights in and out. So I've rolled my shoulders back, put the shoulder blades into their pocket, right? And we're gonna gauge in and out. I'm gonna turn this flash off. It's driving me bonkers. Okay, that didn't work. In and out. So as I turn, right? 4, 3, 2, and 1. Hold it. Down and up. Just rotate. Two more. Right, and down. And stretch it out really quick. All right, so thinking about back muscles, right? Again, you're gonna lean forward because they're light weights, and again, you can do this without weights, but we're just gonna do a reverse fly. Squeezing through the shoulder blades, pulling back. In 4, 3, 2, and 1. Roll the head around, that generally gets up into your neck muscles, and roll the opposite way. With chronic pain, 2 to 3 pound weights. Don't need more than that until you feel like you're ready after those 12 repetitions to move up to 5. But make sure you're building onto it. And there are certain exercises, if we were to reach long away from the body, right? We don't want weights that are too heavy on shoulder joints. So when I do Pilates and I teach Pilates, we're never over 3 pounds because everything that we do is elongating and further away from the center of the body. All right, let's talk about the band. So loop bands are the best things to have, right? Be careful, half the workout's getting a band on anyway. And I love band for chair workouts. So strength training the legs, right? We're gonna keep it here, keep resistance on it, tap out and in. Get my weights out of the way. Out and in. Again, they're still sitting, or you're still sitting in the front third of your chair. We're tapping out and in. Two and 1. Now, we're also going to use this chair for squats. So you're going to come up, back down, lift and lower. Chair is there. Use it. Another one I like is to step out and lift, because what does that look like? something in your daily life that you would use this in. Getting in and out of your car, right? And then 2 more. Last one, and in, and hold it right here. Now, we're gonna take heels together, and we're just gonna come up onto our toes, press out, out, out. 4, 3, 2, 1. Now, you can move this down to your ankles, and now we've got a whole nother level. Gets a little bit tougher when you get it down to your ankles. All this has got to move. Stay sitting up tall. Remember, we still want to fire up the core here. How does this help with knee pain? How does this help with back pain? We are going to talk about that. So hold here while I talk. Lift and lower on those heels for calf raises. As you build core muscles, and we're going to do a little bit of a core workout, but as you build core muscles, now you're supporting your back. And that's why back pain starts to alleviate. I'm not changing your spine, I'm not changing the bone structure, but as you build here, we start to have stability for the spine. And the same thing starts to happen all the way down. When you build stabilizers, you're supporting your joints. Oh, I know, I love it. I love stabilizers, you guys. Coming from somebody who, hold it right here, lift one heel at a time, that was in pain a good 80% of my day, and now I'm down to maybe 10%. Sometimes for a few hours I'll be up higher, but for the most part, you guys, I'm not in any pain. And that's very much due to the movement I do. Yoga, Pilates, cardio, we got to get that blood pumping, flowing, oxygen going, so your muscles can work. All right, taking this off. Holding onto your band. Your band can be used for strength training, even with the arms. So if I turn to the side, I place one hand on my shoulder and back. And I'm gonna get to knees in a second here. Other side real quick. 8, 7, 6, 5, 4, 3, 2, 1. And this is just a generic workout, right? All right, let's talk about knees. If you want a specific workout, we could do that online together, so just message me. Let's talk about knees though. My mom has had a knee replacement, and that physical therapy, it was so important, but it's also things I naturally include with chronic pain, especially for knee. So either with a band, you could do it on one foot, right? And you're just gonna kick in and out. Straight. Even without a band, what you're watching is for your knee to be tracking in line. 3, 2, and 1, okay? And then we're just gonna pulse down. So you can imagine holding onto a band. 4, 3, 2, 1. Now we're just gonna pendulum swing it out. Swing it out. So you can do this standing. Make sure you keep sitting up tall. 2 and 1. We're gonna add turning out, right? We still want that knee. We still wanna be able to rotate through the hips and see our knee track properly. Okay, so we're just going to press down like a gas pedal, right? Pressing the heel down, toes are up, and you're getting a double workout on your hip flexors. So, but if they start to tighten up, give it a break. You know that's at your limit. Add the swings. 4, 3, 2, 1. Pulse, pulse, pulse. 4, 3, 2, 1. Let's do the other side. Bringing it up and down. Pressing down. Use your band if you want to. 3, 2, 1. Swing it out and in. 2, and 1. Pulse, pulse, pulse. Let's turn it out. Pressing down and up. Two. It's great, you guys. We're getting to stretches here in a second. Swing out. So again, we're just watching, right? You want to make sure that patella is in line. 2 and 1. Stretch it out. Kick a heel out, come forward. All right. One of the most important things with chronic pain is stretching and having a good stretch program in place, because you keep working those muscles, right? They're going to tighten up. We want them to tighten up, that's great. But we don't want them to tighten up to the point that your joints aren't moving. So gentle stretching, yoga from your chair, from the floor, any of that, right? So I'm gonna go through a series that works for me. And I have almost found that I have found when I do it, I move the way my body wants to move. If something doesn't feel right, hi puppy. If something doesn't feel right, don't do it, right? My video changed again. Leave it out. So when I say move the way your body wants to move, don't overdo it, don't overstretch, don't overextend your back, any of that, right? All right. I don't know why my lighting keeps changing on my phone. I hope it's not doing that to you guys. Okay. Seriously, I'm trying to fix it. I just look like lit up behind me. Okay, so let's rotate. Exhale. This is a good one. If your back feels tight, right? And in. Big inhale. Exhale, lowering down. And up. We're going to rotate again. You can do this from your mat on the floor. All works, right? Coming center, pulling in, rolling back. And up. All right. Reaching up overhead. Good. And over. Again, so again, we're stretching through the side and reaching up. Last time. Want to hold it, hold it, hold it. All right, hugging the knee in. Circling that foot around, working out through the ankle joint. Pulling it out to the side and hugging again. Good. Other side, bring it in. Foot circles around. Keep hugging it in. Again, like I said, you could do this all standing. Just change positions. When I teach my senior class with this, half of them are in the chair, half of them are standing. And you just learn to modify. And up. Okay, core. Hands up. Reach to the side. And opposite side. Big inhale, exhale, and over. We'll come back to stretching here in a minute. Don't want to leave core out. So your obliques, right? Side to side. Yes. Keep going. I'm going to try to fix some lighting here. Side to side. 4, 3, 2, and 1. Hold it here and crunch forward. I am going to be doing, I've been saying it for a week, but I'm going to be doing a chair Pilates. I've been saying it over and over, and that one's going to be so good. It's going to really go in line with chronic pain because all those exercises are so good to do. And 2 and 1, hold and reset, right? Okay, so now taking it over 1 knee at a time, crisscrossing. Remember, we're building up the core. You guys, your core is in the center of your body, and it's not just your abdominal muscles. When I say core, we're talking about your abs, your back, your glutes, your shoulder blades are all core. And they are the center of your body, right? It's where your limbs are coming off from. So if this isn't strong, all sorts of things start happening and your risk of injury goes up. 2 and 1, hold it right here. Now, we're just gonna take the hands out and go side to side. Working those obliques again. Now, if you have a small ball at home, we can incorporate that at any time. Lifting the heels. We're going to crunch and lift. So as the knees come up, right, you're gonna crunch forward. Forward, forward. In 4, 3, 2. Remember to listen to your body. If you needed to stop, you stop, right? Big deal with that. All right, so there's a little bit on core. You can add 1 knee at a time. There's a whole bunch we can do, you guys. Other side. 3, 2, and 1, and down. So keep incorporating that core into it. Rotate again. And over. We're gonna finish up with stretching today. Thanks for joining me. Arms come back and behind if you're in a chair. If not, just take them back and hold. All right, turning to the side. One of my favorites. Get into this deep stretch for your hip flexors. Big inhale up, reach this arm up that's farthest away from your chair, and then over to the side. And up, and down. Reach it up again 1 time, and over, and hold. Take it center, lean forward, push your knees out. If you can reach to the floor, great. If not, keep those knees pushing out. You can always lift off from the chair, feel that stretch. Plant your booty safely back down, push the knees back out. All right, turning to the side. Lifting up. So I try to add in some stretching or using a roller every night. I know that if I'm crawling into bed and I'm thinking, I'm in a lot of pain, just getting into bed, chances are I need to stretch or roll out, and then it's a whole lot better. And you don't wake up so sore, by the way. And back center, push those knees out. Okay, back to that cat stretch. Pushing back and away, I want you to shift to one side this time. Sit up, bring that belly button in, shift to the other side. And roll it back, shift off to that side, and back. And up. Back to that calf. So hand always above the opposite knee. Keep a flat back as you hinge forward. Do it this way. Might be nicer for you to see. Instead of rounding out, right? Keep that flat back. Other side. Hand above the bent knee. Hinge forward. It's a pretty deep stretch. Now, quad stretches are tricky to do sitting in a chair. So if you cannot grab a foot, this works just fine. Just taking the foot back. You can grab to the side. Hold on to your chair. Even better, right? Grab a foot. And then opposite side. Stack your hips. I see a lot of hip hiking with this stretch. this, level out the hip, those hip bones right there, and down. Okay. If I turn my chair to the side, you're standing behind a chair, you could stretch it back, stretch those arms out, tailbone goes out, you're a flat back, feet go wider. It's a fantastic stretch. You can add your rotation and off to the other side. All right, I've kept you guys long enough. What time is it, by the way? Oh, not as bad as I thought it was. If you have any questions, let me know. If you want to develop a workout routine for yourself personally, just let me know. Message me. We can set that up. I've got my website going on Rocksteady 365. We can certainly go over that. All right, who's still with me? Everyone's checking out. All right. It was so good to have everybody hop on. Okay, well, I miss everybody. We will get back to the gym eventually. But until then, this is actually a great way to reach out to people. If you know somebody that deals with chronic pain and they weren't able to hop on today, please send them my way. I would love to help. That is, maybe that's what's going to come out of what I deal with every day, is helping other people with this. If you have questions and I'm not able to answer them, I do have chiropractors and physical therapists that I reach out to that can help answer any of those questions. We will be getting some workshops with guest presenters as well going. So, all right, you guys, thanks for watching, and have a good Friday. Thanks for fasting today and thinking of everybody. We'll talk to everyone soon. Bye.